Welcome our viewers to this channel once again. Today we are talking about cervical cancer, and we're going to follow the following. We are going to understand what cervical cancer is, what are the different types of cervical cancer, the risk factors, the signs and symptoms, how can you screen for cervical cancer, management, complications, and prevention of cervical cancer. Why are we talking about cervical cancer? Did you know that cervical cancer is among the commonest gynecological cancer, cervical cancers? Please, you were supposed to know such information. If you wanted to know about cervical cancer, if you all along you wanted to hear get something scientific about cervical cancer, please subscribe. If you want to know how can you prevent yourself from getting cervical cancer, subscribe to our channel, share, follow us on YouTube, Instagram, just type in Dr. Pills 30. On TikTok, we are there, we are giving such content. And also, if you have a private question, you can WhatsApp us on 0708 30 24 82. So let's go straight to the point. What is cervical cancer? Cervical cancer, as you hear cervical cancer, is the cancer of the cervix. Is a cancer that grows in the cells of the cervix, okay? Then, what is a cervix? We shall understand what a cervix is. A cervix is the end part of the uterus where the vagina meets the cervix, the uterus, okay? If you see, the cervix is the end part of the uterus where the uterus meets the what? The vagina, okay? And the cervix has got different parts. It has got the ectocervix and endocervix. So the cervix has two parts. We have the ectocervix and the endocervix. The ectocervix is the external part of the cervix, and then the endocervix is the inside part of the what? Of your cervix. And then what you have to know about the cervix is that in between the ectocervix and the endocervix, we have a layer called the transformation zone. The transformation zone is where the cervical cancer starts growing from. Are we together? I told you the cervix has two parts. We have the ecto and the endo. But in between the ecto and the endo, we have a layer or a space called the transformation zone, where cervical cancer cells starts growing from. Okay? So that's part of the cervix. What are the importance of the cervix? The cervix one, it opens and allows the baby during delivery to come. It also allows the passage of sperm during sexual intercourse in order fertilization to take place. It also allows menstrual bloods or vaginal menstrual bloods to come out to the vagina during periods. Okay, those are the major importance of your cervix. Now, we are going to understand what are the types of cervical cancer. There are majorly two types of cervical cancer. We have what we call the squamous cell carcinoma, and then we have what we call the adenocarcinoma. Okay? We have the squamous cell carcinoma, and squamous cell carcinoma is the most killing cancer of the cervix. With adenocarcinoma is not common. It's not common, but the most type of cancer is the squamous cell carcinoma is the commonest one. Now, what are the risk factors of getting cervical cancer? One, the risk factors of getting cervical cancer, number one is early sexual intercourse. If you have sex at an early age, you are most likely to get cervical cancer. Then another point is repeated sexual intercourse. Repeated sexual intercourse. If you repeated unprotected sexual intercourse, repeated unprotected sexual intercourse. If you have repeated unprotected sexual, you are likely to have sex with someone who is having HPV virus. And another point, this one brings us to another point of HPV virus. HPV virus is the commonest virus which causes cervical cancer. And HPV virus, let's talk about HPV virus. HPV virus, the most common type which causes cervical cancer is 16 and 18. There are different types of HPV virus, but the most common type which causes cervical cancer is 16 and 18. Therefore, that's why we encourage you to do what we call HPV vaccination at an early age. Therefore, it's very important for you to understand that when you have sexual intercourse with someone having HPV virus, you are prone to get cervical cancer. Now, another risk factor of getting cervical cancer is what we call immune suppression. If your immunity is suppressed because of other diseases, for example, diabetes mellitus, you have HIV, you have hypertension, you are prone to get cervical cancer. Then you also have what you call family history, my friend. If in your family there is someone who has ever died of cervical cancer, you also have to be careful. Put it in mind that you're most likely to get cervical cancer. Then also we have delayed cervical cancer screening. If you delay to screen yourself from cervical cancer, you are likely to die of cervical cancer. Okay, these are most of the major risk factors of what of cervical cancer. So if you have to know that, one, I told you early sex can make you prone to cervical cancer. I talked about repeated unprotected sexual intercourse. Also here we put in repeated STDs. If you don't treat your sexually transmitted diseases very fast, they can make you prone to cervical cancer. Okay, so let us talk about the signs and symptoms of cervical cancer. We are talking about signs and symptoms of cervical cancer. Here you have to be very, very attentive. The first sign of cervical cancer is what we call asymptomatic. My friend, you may have cervical cancer but without any sign and symptom. You may have cervical cancer without bleeding, without any discharge, without pain. Be careful. You may have cervical cancer without any sign. So that's why it is very important for you to go for cervical cancer screening. Another point is abnormal vaginal bleeding. You may have abnormal vaginal bleeding. For example, you have spots, you may have bleeding in between your periods, you may have also heavy bleeding. You can also have what we call vaginal discharge, abnormal vaginal discharge. And this discharge may start being watery, then becomes reddish brown. You have to get concerned. You can also have what we call pelvic or back pain. Severe. You've tried to use painkillers, but the pain is no longer going. Or that recurrent back and pelvic pain, you need to go and meet your doctor for cancer, cervical cancer screening. You can also have what we call cervical changes. Cervical anatomical changes. Your cervix may be lacerated, may become ulcerative, may become reddish, may be inflamed as a result of the cervix, of the cervical cancer. Now, let's go to screening. How can we screen for cervical cancer? The screening of cervical cancer is mainly done at the age of 21 to 30 years, depending on the country. But within 21 to 30 years, you're supposed to go for what we call pap smear. You go for a pap smear. And this pap smear, if it's supposed to be done after every 3 years, that is in case your first observation was normal. But in case your observation was abnormal, your idea likely to go and do to do the examination after every 1 year. If that is in the case your results were abnormal, you are supposed to go for every year. In the case they are normal, you go for every 3 years. And this pap smear demands you clock 60 to 70 years, you're supposed to stop or discontinue with pap smear. Then you also have what we call the HPV serology. HPV serology, they look in blood, you go, they take your blood and they look for the HPV virus, whether you have it in blood. There are other screening, we have what we call colposcopy. Colposcopy is where your doctor will examine the cervix, puts there what we call the acetic acid, and then look for what we call the acetone white lesions. If the acetone white lesions are very many or numerous, it means the cervical cancer has spread, has grown up. Okay, so that's how we screen for cervical cancer. Management. Remember, management of cervical cancer, my sister, management of cervical cancer, my sister, depends on the stage. If you reach there, depends on the stage. Your doctor or the oncologist will decide on what to do depending on the stage of your cancer. You can decide to do what we call conization. We can do what we call cryosurgery. You can do what we call total hysterectomy, where your cervix is completely removed. That is in case it has overspread. So the management depends on the stage of your cancer. The better if you go early, you have high chances of your cancer getting healed. So let's go to complications. If you don't treat this cancer in time, you are going to get the following complications. Woba tojanjabye bulungi cancer, woba togenze nga bukyali, these are the things you're most likely to get. One, you're going to get what we call urinary obstruction. You get what we call urinary obstruction because the cancer grows and affects your bladder, so you get what we call urinary obstruction. You're also likely to get what we call hydronephrosis. Hydronephrosis, you get it when the cancer has descended to your kidneys. You also you're likely to get what we call edema. You're likely to get constipation. Okay? You are likely to get what we call death. In case you don't treat, you're going to die. In case you don't go early, you have to die. It's among the complications of cervical cancer. How can we prevent? Prevention is done in two. We have primary prevention and secondary prevention. In primary prevention is where you get what we call HPV vaccine. Okay, you get what we call the HPV vaccine in primary prevention. Then in secondary prevention is where you have to go for screening, for pap smear, you have to go for colposcopy and all other investigations done by your doctor. You have to go and the doctor do what we call a vaginal or pelvic examination in time to prevent yourself from getting cervical cancer. My friend, if you liked this content, if you've liked such information, share, like, place a share button, place in your question about cervical cancer. Leave a question there, comment. If you have anything that you've not understood very well, put in the comment section. I will make sure that I read it and then I try to answer your question. Next video or next discussion will be on cortisol hormone. Do you know how is cortisol hormone related to belly fats? Do you know why your bellies are growing? Your belly is growing fat. Do you know why you have a lot of fats around your belly? That is the question I'm going to tackle. That is the next lecture. I'm going to talk about cortisol hormone and belly fats. Please, if you've liked this, just subscribe, follow us on all our channels. Thank you. God bless you.